My name is Taslim. I'm a clinical dietitian at the Royal Alex Hospital.
Nicole. I'm a clinical dietitian here at the Royal Alexandra Hospital in medicine. A little bit about my job and what my everyday work life kind of looks like. Really, it's a lot about seeing people, talking with staff, as well as talking with the patients. Of course, we print off our census and review our patient nutritional census and try and prioritize our day for consults and who we are needing to see for nutrition support, as well as malnutrition patients that we may have been consulted on.
It really goes through just prioritizing your day, looking at what we call our census, so the unit that you're working on and the patients that are there, seeing what patients that you've been consulted for, and then prioritizing in a way to see what patients are of high need, so those who would be on what we call TPN, which is our total parenteral nutrition, or if they're on a tube feed, so getting nutrition in a way that's outside of how we usually normally get our nutrition. So prioritizing that way and then seeing what patients need education, coordinating and also working with the other interdisciplinaries team. So the doctors, the speech pathologists, the nurses of the patients as well too. Some common misconceptions about dietitians is that many times I think people will think that you're there to really judge their food or what they're eating. And other times another misconception is that you'll know everything and every detail about what the current fad diet is or what do you think about something very minuscule. Dietitians specialize further in different areas as well too, and there's always something new. But I would say the bigger misconception is that we're more of the Weight Watchers, which really many times in a clinical setting is doing the inverse, which is making sure that patients are not malnourished and that they're getting the nutrition requirements that they need.
Another misconception is that we make the food in hospital or that we are doing meal plans for everybody in hospital that we're following. A lot of people don't realize or even are aware that we have things like tube feeding, like Taslim was saying, or even TPN, or the peripheral or central parenteral nutrition that we can feed people in other different ways than just eating.
What made me choose to work as a dietitian with the AHS was the wideness of the scope. So I was able to transition and learn a lot of different things. So I was able to work as an outpatient dietitian, as a clinical dietitian in inpatient setting, and even in public health. And also the leadership that supported me to be able to navigate through those areas and pick up skills and use those skills in a way that was beneficial and helpful to others.
What I love about working here at the Royal Alex in Alberta Health Services is the fact that it is more of a family environment, and working with my colleagues as dietitians in our office here at the Royal Alex, as well as just even the nursing colleagues and medical colleagues that we work with every day, whether that be the doctors, the nurses, the rehab team, the PTs and OTs, everyone working together. It's quite a collaborative approach here at the Royal Alex. So it is like we kind of like to say, it's like a family. So it is more of a family environment where we all want to support each other.